Welcome to the Mission Critical Partners Podcast Network. Today, we're discussing with industry thought leaders how public sector organizations are evolving and how the transformation will result in improved outcomes in the communities they serve. The MCP Podcast Network is hosted by former journalist and current MCP content specialist, Glenn Bischoff. Here's Glenn Bischoff.
Good afternoon and welcome to the MCP Podcast Network and this session entitled Alternative Response Strategies for 911 Centers. I'm Glenn Bischoff, MCP's content specialist, and it is my privilege to be moderating this session. I'd like to start off by introducing our guest speakers. First is Bonnie Maney, Operations Lead within MCP's Facilities and Operations Market segment. And then John Ferraro, who is an emergency number professional certified 911 Center Executive Director for Northwest Central Dispatch System in Arlington Heights, Illinois. Bonnie and John, thank you so much for carving out some time today to chat with us about this important topic.
Sure, thank you. Happy to be here.
Sure. Thanks for having us.
So we have 5 topic questions that we'll work through. And John, I'm going to come to you with the first question, which is, what exactly is the problem that we're trying to solve here? What is leading us to this discussion about alternative response strategies?
Well, sure. I think a big part of it is just change. You know, in public safety, sometimes we're resistant to change, right? So I think what's happening is 911 centers are overwhelmed. We're having difficulties with staffing coming out of COVID, and our telecommunicators are probably apprehensive about what the future holds. There's going to be big changes in 911 in terms of the kind of information that they're going to receive and how they're going to digest it and how they're going to disseminate it to responders. So I think the problem is just a lot of change at once, and it's trying to cope with those changes and make sure that not only us as management and the people trying to help make decisions on how this will go, but also how it impacts the telecommunicators themselves and how they're going to survive through all of this change to our environment.
What specific factors, John, are you seeing in your center that might be contributing to this sense of overwhelming within the center and the telecommunicators that work in it?
Well, I think as we ramp up and we get ready for next generation 911, and when we say that, we're talking, of course, about changing the network from old copper line to an IP-based network that is capable of handling more things, right? It's capable of receiving pictures and videos and text messages. We've been sort of stepping towards that for the last several years by using workarounds, by using third-party vendors. To help us get better caller location or help us receive text directly from the cell providers. Now we're talking about in the future receiving all of that information direct from the 911 network. And so I think what's happening though is we had to upgrade equipment. For example, in my center, we needed to go to a brand new phone system. Well, anytime you change systems like that on telecommunicators, they are no longer proficient. And so when they don't feel proficient and they don't feel like they can do their job right, it's a source of stress for them. It's a source of the feeling that they're just not doing their job the way that they have always been able to do it. Another example is their main tool, the computer-aided dispatch system. That system has to be ready for what's coming. It has to be ready for, like I said, the digestion of new media, video and pictures and that kind of stuff. And so when we go to upgrade those systems, that sort of leads to this feeling of, I'm overwhelmed. I have too much going on. I was an expert at my job and an expert at using my systems. And now I'm faced with all this new equipment that is going to handle all these new things that are going to be dropped in our lap one day. And it's just an overwhelming feeling. I think it's a stressful feeling. And it's something that we definitely have to work through as an industry.
Thanks, John. Now, Bonnie, I'd like to come to you next with this same question. You're in a lot of 911 centers from coast to coast. So I'd like to have you, provide some perspective on a sort of a macro level, and talk first about this feeling of being overwhelmed. Too many emergency, non-emergency calls. It seems to be a problem regardless of whether next gen 911 is in place, or legacy 911 systems are still in place. So can you speak to that a little bit, and then maybe talk about some of the other factors that are contributing to this feeling of being overwhelmed?
Sure. So, John hit it on the head there. Number one, change management and being able to trying to manage this change, and how that can actually lead to change fatigue, and part of that is that lack of confidence and that anxiety that goes along with it. And what we're seeing as well from the broader part of this too is, like you said, regardless of if there's next gen or legacy, um, that within all of this change, and this is one of the things that we're seeing, is a lot of mission creep over the years. The primary focus of a PSAP, or a public safety answering point, is to receive 911 calls and be able to get immediate access to emergency services. And over the years, not only have we gotten, all these wonderful pieces of technology that have evolved and try to help them do their jobs more efficiently, but because they're 24/7, a lot of times they start getting all of these ancillary duties, all these other functions. And what we're saying, they become a victim of mission creep, something similar to scope creep in a project. But these, answering local government lines after hours, or taking calls that are now like just information calls that come in on 911, or even their 10-digit lines. And so we see that happening now. Some places have been able to help combat some of that by having 211, 311. But not all places are large enough to be able to, have those types of systems either. So mission creep is definitely one thing that we have seen. So it's analogous to cleaning out your closet, right? Every once in a while you might, add something to your closet, but if you don't start taking things out, then they start not being able to focus on their mission. And that's really being compounded now by, as John said, with the pandemic, and they're not only understaffed, but they're short-staffed, and they're being asked to do more with less. So you have mission creep. We have a lot of things that are still being manually done, when there are software applications that can help divert calls before they get into the 911 center. And such things like they call ASAP to PSAP, which takes an alarm from an alarm company and can put it directly into a CAD system, which John says your computer-aided dispatch, without even having to talk to a telecommunicator, so a 911 operator. And then just the other one is just all these new resources, community resources outside of the traditional police, fire, and EMS response. We now see that telecommunicators have access, or getting slowly access to, alternative types of resources that can also be dispatched. But along with that, again, comes that need to be competent and to reduce that anxiety, to know that they have the training and the expertise to be able to triage those types of calls as well.
Thanks, Bonnie. Bonnie actually jumped into our second question here a little bit, so which is fine. I'm gonna come back to you now, John, and ask you for some thoughts about alternative options here, alternative strategies. Bonnie touched upon 211 and 311 lines. She talked a little bit about some automated solutions. She talked a little bit about alternative response approaches, but she didn't specifically talk about some things like nurse triage lines and mental health clinicians. And I'm gonna come back to Bonnie in a second about that. But John, what are your thoughts in your center? What automated or alternative response solutions have you either implemented or are looking at today?
Yeah, I think Bonnie makes a great point about mission creep and what we have to be careful of. 911, it took years for 911 to really get its footing. The first 911 call was taken in 1968. I work in the northwest suburbs of Chicago, the third biggest city in America, and Those Northwest suburbs didn't receive 911 calls. We didn't start receiving 911 calls until 1991. It takes a long time to get an idea like 911 out there and get people comfortable to it. So I think it is important to not move away from mission, to not move away from our core mission, which is answer 911 calls, receive information, dispatch responders, and give instructions that are potentially life-saving while the responders are on their way out there. Those are really important missions. And when you start talking about adding in, okay, now we're receiving videos, now we're receiving other kinds of notifications, Bonnie mentioned ASAP to PSAP, like alarm notifications or wearable medical devices, or just pictures and video are the best example. What are we doing with that information? Are we asking our telecommunicators to actually look at that information, digest it, and use it in our call taking process? Or is it more than that? I taught a class in Indiana last week, and when Bonnie was talking, I immediately thought of one of the students who said, I'm an ex-Marine that fought in Afghanistan, and I chose 911 because I did not want to see these things. I wanted to be involved in public safety, but I did not want to be the one that had to look at these things. So I wanted to be involved in law enforcement and public safety. I did not want to see these things any longer. I saw enough when I was in Afghanistan. And so I thought it was a really interesting point. And I think it's a lot of what a lot of our telecommunicators are feeling across the country is, I don't want to see this stuff. Now, that might be change that is unavoidable. That may be coming, but we do have to make sure that it's not interfering with what our original mission is, which is to receive 911 calls and to receive information, to record that information and to dispatch responders. I mean, we can't move away from that core mission. So you start thinking about, what are some of the other ideas? I mean, I know our industry is working on this. I know the National Emergency Number Association, NENA, and APCO have put together work groups to really discuss these things. We just had a discussion at my stakeholder meeting this morning where we were talking about Fusion Center. Do you have a Fusion Center that has off-duty law enforcement or off-duty firefighters or paramedics that actually man the center and are capable of receiving that information and digesting it and seeing, okay, what do we do with it, and making the decision on needs to go to the responding officer, or this needs to go to investigations, or whatever the case might be. That could be a simple answer. The problem, of course, is money. So we're, as a dispatch center, Northwest Central is located in northwest suburbs of Chicago, fairly nice area, nice suburbs. But the idea behind our center is not only operational efficiencies, but it's also a consolidation that saves money. It's simply put, it's economically a very feasible option for our communities to combine together to share costs on a 911 center. If you start adding, I need a dozen, I need 15 more employees, I need to add on to my building for a fusion center, we need to start upgrading these systems and everything else, all that sounds like an awesome idea. But what's probably going to happen around the country is we don't have money for that. So we'll just give this information to the 911 center and we'll let them, give that information out to the responders and we'll go from there. I think I've pointed out that there's some concerns there, that there's some issues with that. And so we start looking at what's the most economically feasible thing to do, and how can we handle this? And, again, consolidation and communities coming together, shared government services is definitely going to be needed in order to handle this. Small communities, smaller suburbs, rural areas, they're just not going to be able to afford what it's going to take to actually use this stuff in the best way possible. Let me make it clear, I'm not against receiving this information. I think it's really good information, and however we can help the public more, we should always have that in the back of our minds. We should always be about the best possible service to the citizens. So I get all that, but I think a lot's going to go into that.
Thank you, John. So you mentioned funding as an obstacle to implementing some of these alternative response strategies. We're going to talk about that and other obstacles in more depth in just a moment. But before I do that, Bonnie, I want to come back to you and have you talk about a little bit about a couple of alternative responses that we really haven't touched upon yet. One being nurse triage lines and another being mental health clinicians who are either embedded in the 911 center or working for a third-party provider that's supplementing the the 911 center's response. So can you speak to both of those, what you've seen in other 911 centers across the country, and how they might help this situation?
Sure. Well, so the nurse triage lines or nurse navigation, it is something that is a newer trend over the last few years, and the idea behind that is to be able to triage a call, understand when it's maybe what they call a low acuity call or really not a life-threatening emergency where it would require EMS to come out to you, and be able to, outside of the telecommunicator that initially answers the call, transition that to a medical practitioner or a nurse in this case, who then would go through and triage the call. And what we've seen is that with these systems, they actually can provide guidance to let the person know, well, you have a local medical express emergent care near you. It's at this location. They've been known to actually help arrange with transportation, calling them an Uber or a Lyft, some sort of ride share, or trying to help them make an appointment with a local doctor. Again, not trying to try to triage them with appropriate level of care, rather than going straight to the emergency room or emergency department when they really don't need that level of medical care. So that's one thing that we're seeing. There are some that are associated with current emergency dispatch protocols or emergency medical dispatch, EMD, in some of those. And then there's other ones that have been created, in DC, DCOUC has actually created their own standalone version of this outside of their emergency medical dispatch protocols. The other is the mental health clinicians, and I'm sure John has some insight to what's happening probably in Illinois with this too. But we're hearing now more and more about 988, and 988 is coming, and it is scheduled to arrive, go live July of 2022. And a lot of places already have, 10-digit mental health crisis lines and relationships, but same idea and concept that came about with 911 of being a 3-digit, easy to remember number for those that need, emergency services. 988 is to be the same thing for those that are having, and it's really not just for mental health crisis, but also for if there are substance abuse or domestic violence. Those also have a very high rate of homicide and suicide associated with them. So the mental health clinicians, one of the solutions, while that's all being worked out with 988, there are some places that actually are putting mental health clinicians or social workers embedded within if not within the 911 center, within the department and the agency to support some of them. Some of them are actually then creating field teams or community paramedic teams that go out, and we see these in the news, in the media, all over the place right now. And there's this coordinated effort, and then wanting to, in many cases, marry this up and integrate with 988 when it comes on board. But to John's point as well, these are great things, but we also need to make sure our telecommunicators are ready for this as well. And when I think back again to mission creep and such, it's like, okay, if we don't have the funds and everything to staff more people in the centers, then what other services have to be adjusted? And where it comes into those missions of a PSAP. And so this dialogue needs to take place to be able to make sure that the telecommunicators have the training, the experience, and they're ready to be able to triage these calls. Hopefully 988 will take a great portion of them off. There'll be a direct number. But John also pointed out, 1968 to 1991, before 911 was even available in Illinois. How long is it going to take for 988 to, take hold and be as commonplace of a household number that, our children know when they're in elementary school or kindergarten as 911.
Thanks, Bonnie. We're going to jump in a moment back into some of the obstacles that exist to implementing some of these solutions. But John, I wanted to come back to you first and just get any thoughts you might have regarding nurse triage lines and embedded mental health clinicians. Are you doing things like that? Do you see other centers that you come across in the region doing things like that? What do you think of the merits are of those types of approaches?
Yeah, I really think that any of these things that sort of change our way of thinking and move maybe some of that activity from the 911 center to things that are more meaningful and useful, like a nurse triage, for example, I think is a terrific idea. I really do. It's not just on the 911 center aspect. You look at some of the communities that I'm involved with, you might be talking about communities with 60,000 people that have 3 or 4 ambulances on duty at once. That's obviously not a tremendous amount of ambulances for that many people. And the thought has always been, since I've been involved with 911 for the last 28 years, when somebody asks for an ambulance, they get one. And so that has not only taxed the resources of the paramedics and the EMS systems, but it's also taxed the resources of the 911 center, because now everybody knows I dial 911, I get the help I want. I don't want to change that model necessarily. I don't want people to think they're not going to get the help. But if there are better ways to handle this, if, like you said, if there are ways to actually reduce the workload on the EMS system and on 911 by potentially triaging with a nurse before paramedics even arrive, and handling something at home that can be handled at home rather than a transport to the hospital, then I think that that's the way we have to change our thinking. It's just a simple example is when during COVID, we actually have a tool that was a self-assessment tool, and it was put on our website and advertised amongst our communities. And basically it was the opportunity for somebody that felt like they had COVID symptoms to fill out this questionnaire that didn't take very long. It was all automated through the website, and it had different outcomes. And some of the outcomes were stay at home, get plenty of liquids, take Tylenol if you have a fever, and if you get any worse, contact 911 or contact your doctor. There were different outcomes there, but that prevented people from even dialing 911 when they may not have needed to do that. But everybody was really nervous about COVID. It's new, it's a pandemic, it's scary. And so this was a source of information. We made it clear in the beginning of that process, if you have an emergency and you feel like you need to be transported to the hospital, don't hesitate to dial 911. But it's just an example of a way where you may be able to divert some of the activity away and not overwhelm a 911 center.
Hey, thanks, John. John, I'd like to stay with you and jump back into the obstacles. You mentioned funding being a significant one, but there are others. Culture can, surely be an obstacle to implementing some of these solutions. Recruitment and retention of 911 telecommunicators is another obstacle that I can think of. What are some of the obstacles that you think are the most prevalent and vexing for the 911 community?
I mean, being honest with myself and being self-aware, I will say that culture is a big obstacle. I'm the son of a police officer, the brother of a police officer, friend of a lot of police officers. It's tough to hear about drastic changes in response to patients that might be having a mental health crisis. And so, I had to really open my mind as somebody involved in this industry and got involved at the state level, discussing these things with the group that thinks that police should not be dispatched to these types of incidents and it should be mental health. From a 911 perspective, I had to kind of give in a little bit and understand that this change is happening. And, there are people that, really believe in the change and think it's a good thing. And even, some law enforcement understand the reason behind it, that perhaps there are mental health care officials that are better qualified to handle these calls. Okay, so I'm getting there, right? I'm getting on board and I understand that this is the change, this is the pendulum swing. Again, culturally, it's hard. When you're working in 911, I've been doing this for 28 years. It's really difficult from a cultural perspective, and I'm just using myself as the example, to just automatically change your thinking. So think about all the employees, all the people working in 911 who've worked with law enforcement so closely for all these years. Now you're telling them you're not going to dispatch a police officer when there's a mental health crisis. You're not going to dispatch paramedics. You're going to dispatch mental health workers. That's a big thing to overcome. That's a really large attitude adjustment with how this is all going to work. So I think cultural is a huge obstacle, but one that just needs a lot of education and a lot of the reason. Telecommunicators are very practical people. We need to know the why. We need somebody to explain to us, this is why we think this is a good idea. And we need to have a lot of research and support to kind of show us why. And so I think that's a huge obstacle. I'll go, of course, back to the funding. Again, 911 can be a very expensive venture. There's a reason why consolidation has occurred all across the nation. My center has been consolidated since 1971. We've been an example for shared government services for that long. Very proud of my predecessors and have worked here since 1993. And I just think it works and it's a proven concept. There's going to have to be more of that. There's going to have to be more shared government services to overcome that obstacle. More communities coming together, more communities joining existing centers. That is the way through this, because this stuff costs money and nobody is necessarily ready to pay more taxes or pay more fees on their cell phone bill or whatever the case might be. And so, we really have to look to those kinds of things to overcome that obstacle.
Thanks, John. Great insights. Bonnie, I'd like to come back to you and ask you, about your thoughts regarding obstacles. John talked about funding. He talked about culture. What else is out there that might be an impediment?
Yeah, I mean, and those are really key obstacles, and it is a huge paradigm shift. And John's absolutely right. I think when we first started hearing about this as a trend, I mean, the hairs stand up on the back of everybody's necks, and they're just like, oh no, not happening. And everybody gets very excited and very concerned, and there is a lot of concern around it because it is people's livelihoods. And what if one of them, what if a triage, somebody that you think just needs somebody to talk to, they're not at a violent, critical, actively suicidal stage, going through all your triage and everything. What if one, it slips through the cracks, and then you hear, that they actually did, follow through on whatever? That is tremendously weighing on a telecommunicator. Not only are they practical, but telecommunicators, we're also very empathetic and caring. And, this, compassion fatigue and stress can, really weigh on the health and wellness of our telecommunicators. And that's something too that's also more recently coming to light with staffing and recruiting and retention and all of these issues with, that come along with the pandemic and such. But staffing in itself and retention issues are really nothing new, unfortunately, in the PSTAP. But another piece that is an obstacle, which I don't think we've talked about yet, is competing. And John said, he was absolutely right. 911 is very expensive and getting more expensive, but they are the first line. If there are no telecommunicators to answer calls, we could have all the resources in the world that are available at our fingertips, and we're not going to be able to send them anywhere. We can't send them out. So we need to, in this whole shift, also try to get more traction with our executive level leaderships, and like John is lucky he's an independent. He just, he doesn't fall under a police department or a fire department like a lot of our PSAPs still do, which is really, I think, a blessing, and it makes them very successful in what they're doing. But for those that are still within that traditional kind of public safety hierarchy, getting our executives, our elected officials to understand the impacts of all of this on 911 and on their communities, and trying to shift some of the priorities from the field facing priorities. We do studies, and we hear out there and just in conversation at conferences and different things like that, well, yeah, we're being, paid, less than right now. Maybe they're being paid a driver at Jimmy John's. Well, how do you compete with the private sector in pay and keeping telecommunicators, right? But at the same time, as, people go to executive leadership or the elected officials and say, we need additional funding in the budget for health and wellness, for updated recruitment, for, or salaries. It's like, oh, well, we don't have the money. But then at the same time, you see that, there's in their 5 or 10 year plan, they're building a new fire station. They're building a new police administration building. They're, buying new fire trucks. Where are the priorities, right? Because without telecommunicators having all of that stuff, there's nobody to send. So that also is, I think, another competition with other public safety priorities. 911 keeps taking the back seat, and we need to be able to change that messaging and get them to see the impacts and be willing to take action.
So Bonnie, I'm wondering, and thank you for all of those great insights. I'm wondering, in terms of recruitment and retention, in an environment that has a lot of these alternative response strategies and tactics in place, do 911 centers need to start thinking differently about how they recruit and who they recruit? Are there different skill sets perhaps that might be needed? Talk to me about that a little bit, and then John, I'm gonna ask you to answer the same question.
Well, actually, because John's actually still really actively managing the center, I'd like it to give him the talk about who he's actively, what skills he's recruiting. But I will talk to what we are seeing. So we get a lot of times asked to do a comparison, if you will, for benefits or those types of things, and we'll get asked to compare, I should say, with other PSAPs in the area, other dispatch centers in the area. Well, one of the things that we're seeing needs to shift, or we would like to see shift more, is competing more with the private sector rather than your other PSAPs in your area. Because if you can compete with the private sector today, then you're not going to be competition with the other PSAPs, because they're probably not, thinking about the private sector. But then to John's point, but if you could come together and combine your resources, leverage it, right? As soon as you consolidate, if you have 10 telecommunicators and the other agency has 15, but you're down, 5 or 6 each already, there's already 25. So, and then you reduce your recruiting competition, because right now you are competing for the same recruiting pool. You're in the same employment pool. And so if you can if you can't consolidate, at least come together with a combined regional recruiting approach. Or if you can come together and just eliminate your competition that way by being collaborative. John, I don't know how many centers you have around you anymore, but your competition has to be significantly reduced.
Yeah, definitely. I think we have to back up a little bit and go to the classification, the federal classification of 911 telecommunicators. Many people know this by now, thanks to our associations, NENA and APCO. They've gotten the word out that, we're classified as clerical or whatever the case might be. And that really needs to be reclassified to public safety. And of course, we're part of the public safety chain and should absolutely be classified that way. I think that'll go a long way to some of what Bonnie is saying in terms of the funding for 911, the belief of how important 911 is. It has to start somewhere. And I think it starts at, how do you classify us? Now, many states have taken the efforts to, at a state level, classify telecommunicators as public safety. But of course, that needs to be done on a national level. I think that's where it starts, for sure.
Excellent point.
Yes, thank you, John. So I'm wondering, we've talked a little bit in terms of clearing some of these obstacles. We've talked a little bit about, greater collaboration, maybe perhaps consolidation. We've talked about trying to get executive leaders and government officials, the people who control the purse strings, to reprioritize, their public safety funding initiatives. What else can be done in this regard? John, let's start with you. What other things can be done to clear some of these obstacles?
Sure. I think when it comes to the staffing issues, I don't think I'm reinventing the wheel when I say we just have to do a better job of recruiting, and we're giving it a lot of effort. Why I brought up the classification is because honestly, we do need to pay telecommunicators what they're worth. I'm proud of the salary that our telecommunicators earn here at our dispatch center, but I know that that's a big hurdle, right? We've already talked about costs and how that impacts everything. But recruitment is also about getting the right people for this line of work. So many people don't understand what a 911 telecommunicator is. They just don't. They, even from talking to people in my own personal life, they think that there's dispatchers at our police departments and then we're over here, and somehow when we get a call, we call over there and then they dispatch it. There's all kinds of confusion in the world about how this has evolved and how this is an actual career path that actually deals with emergencies. You've heard the term, maybe the first of the first responders. That word needs to be spread. I think we need more public education. We need to really show the public what's what. I mean, there was a new television show on ABC that actually was pretty decent. I'm not talking about the one on Fox that's fiction. I'm talking about the one that's on ABC that kind of shows excerpts of, or plays excerpts of calls. And, it's a little closer to William Shatner's Rescue 911 back in the 80s, right? That really kind of defined our industry and set the expectation. I think that show is not bad, and it goes towards helping. It's not perfect. There's some inconsistencies there, but I think that kind of stuff really, really helps. Getting the word out, I know Nina, I sat on a national committee for Nina that actually was looking at building curriculum at the junior college or collegiate level for degree programs or certificate programs for people to work in this line of work. And I think that only validates and legitimizes, anytime you attach required education or some kind of certification to a position, now you start talking about paying people for what they're worth and recruiting people from those programs and having sort of a direct line of people into the dispatch center. So I think there are ways to overcome those obstacles. I guess maybe the unknown is that we've known about these things. These are not new things. We've been trying for decades, sometimes to no success. And that is somewhat, I guess, challenging and frustrating at the same time. My dispatch center has 68 telecommunicators. That's our staffing. And we've always hovered around full staff. And I think it's largely because of our competitive pay and benefits. But over the last couple of years, maybe related to COVID, maybe related to other reasons, had some retirements and some other things and some people moving away. And the next thing you know, we're down 7 people. And I know that might not sound huge, but it made an impact. It was more hours worked. And I mean, that's what we started off the conversation with today is why are our 911 telecommunicators overwhelmed? Well, I could tell you just missing 7 people out of our center did overwhelm our people. They're working 12 hours more often instead of 8, and they're that cumulative stress that Bonnie talked about, it's tough. So, staffing a center up to full staff and making sure that we're not overworking or overburdening our telecommunicators is really important. It's sort of the holy grail of how do we achieve that, and certainly we understand it and we understand what we need to try to do. And we're trying to do all those things, but it's escaped us a little bit over the years.
Thank you, John. Bonnie, do you have any last thoughts regarding obstacle clearing or want to comment on anything that John just said?
Yeah, I think John, made excellent points, and as bringing it back around to, why we're having this problem, why are they overwhelmed? I mean, when you start working, overtime, it starts impacting everything downstream. It impacts work-life balance. 911 is a 24/7, 365 role, just like other emergency services. And, there's missed holidays, missed birthdays, missed weekends, missed everything else. But then when you start getting into a vicious cycle of mandatory overtime, and folks start losing their work-life balance. Again, that's where we kind of go back to the health and wellness. And you look at, there's a new awareness, I think, with, thanks to the pandemic, if you will, that, there's remote work. You can work from home. You can, be at home with your kids because you're working your day. You can work remote, and, all of that kind of stuff, which, having to try and come up with a good value proposition, again, another private sector kind of term, of why we should become a telecommunicator, or why should you come and work for us as a 911 telecommunicator. Having to have that messaging, considering everything that they could be having and doing and everything in the private sector, but coming up with that as part of our recruitment strategy, and then from there, really not working against ourselves from a PSAP perspective. You hear all of these negative things, but that's really why. If I'm hearing all these negative things, why would I want to come work in that profession, right? So we need to acknowledge them, but then at the same time, have a really good value proposition of why you should come into this profession. And one of them, actually, quite frankly, is job security. Telecommunicators were not being let go and laid off during the pandemic. You had your benefits, you had, all of that. I mean, that right there is a good one that I don't think we put out there as the first responders, that mantra. So I think there are some things that don't cost us anything, that funding isn't an issue about, to work through some of that kind of messaging piece. But yeah, I really believe we can, as hard and sometimes as, sometimes we can't see the light at the end of the tunnel. I think we can just incrementally, by doing some of these alternative responses, approaches, and things like that, I think we can, help, improve the telecommunicator workforce recruiting and retention issue as well.
Thank you, Bonnie. So we've covered a tremendous amount of ground during this podcast on obviously a very complex challenge. So I'd like to just get to the final question at this point, which is to ask John and Bonnie what success looks like, either short-term, mid-term, long-term, any combination of the three. John, if you were going to define success in this endeavor, how would you define it?
I mean, all the things we just talked about are solved. That's success, right? But I think, if I had to think about this on a very large perspective, I would say that working in 911 is a privilege. And so not only do we have to get that point across to people that we're trying to recruit for this job, but also people that are currently working in this line of work. It's a privilege because we get to impact people's lives in many ways, many times very positive ways. And that's awesome. I always said, I always wanted to do something that was managing people. It could have been in a widget factory. I'm like really lucky that it's in a 911 center. And so I think success looks like sort of this realization that 911 is really important, as Bonnie and I have stated, that we get everybody on the same page with that, from public officials, elected officials, to the decision makers, to the feds and their classification of us and all that stuff, so that we are assisted in our recruiting efforts. And success looks like incremental change when it comes to next generation 911. We all know change is coming, and it has been coming. And I think to some degree there has been some incremental change. Many of us have used, like I said, third-party vendors to handle things like text to 911. And so there has been some incremental change, but we have to continue with that incremental change to avoid mission creep. And so we've got to take a little on at a time in order to serve the citizens best. And I think that's the goal here. But if we get ahead of ourselves and everything is dumped into 911 at once, we're going to be understaffed. We're not going to know how to handle it. We're not going to have enough guidance. We're going to lose more people because there's going to be more stress. And that's not what success looks like. So we need incremental change with this stuff. We need to make sure that we're prepared. We need to be involved. We need to stress the importance of how important this job is to the people doing it, to the people we're trying to recruit, and the decision makers. And I think all of that will help us be successful.
All great points. I especially like the crawl, walk, run analogy that you presented. Bonnie, what are your thoughts? Do you agree with John? Do you disagree? Do you have anything to add?
I could not have said it any better myself, John. It really is all of that. And as you just said, I will just add, I guess, at the end here is that you mentioned just now, Glenn, the crawl, walk, run approach. And that is a way that we can achieve all of those successes that John mentioned, so that essentially we're improving emergency response outcomes, by just starting, taking that first, crawl, that first, and then that first step, and trying to, get engaged, to make a change, looking at it from a perspective of, for some of us saying, well, they say we can't do that, or we can't do that, or we get told no, or whatever. So trying to flip that messaging from that to how can we do this, and working collaboratively. The collaboration is so important. But so yeah, taking that, just take that first opportunity, that first step to start trying to make some of these changes and have these conversations and have metrics to understand what you want to, what does success look like? So when you do have conversations with your elected officials, with your leadership, that you have statistics, you have data, and it's not all about emotion, which we know, sometimes doesn't get us, where we want to go. So figure out what you want to measure it, present the data, start having, trying to have those conversations, and, eventually, hopefully, we will have, and we'll see those changes, and we'll have that success, which again is that, improvements in emergency response outcomes, getting the right resources to the right place every time as quickly as possible.
Thanks, Bonnie. Great points. I especially like the suggestion of getting the emotion out of it, right? Base everything on substantive facts that are, that can't be argued against. So, unfortunately, we've reached the end of our time together. I'd like to thank MCP's Bonnie Maney and John Ferraro, Executive Director of the Northwest Central Dispatch System in Arlington Heights, Illinois, for the generous amount of time that they gave us today and their great insights on a very, very important topic. I'd also like to thank our audience for listening, and we hope to see you again soon on another MCP Podcast Network session. For now, have a great rest of the week.
Mission Critical Partners is a leading provider of data, consulting, information technology, and cybersecurity solutions that are transforming segmented mission-critical networks and systems into interwoven communications ecosystems. Our vision is to improve emergency response and justice outcomes in the ever-expanding markets we serve. Learn more about MCP and subscribe to the MCP Podcast Network at missioncriticalpartners.com.